Intravenous or IV flow rate calculations are used to determine the rate at which IV fluids or medications should be administered. This is typically expressed in milliliters per hour or ml per hour or in drops per minute, known as GTTs per minute. For instance, to infuse 1,000 milliliters over 8 hours, the flow rate would be 125 milliliters per hour, calculated by dividing 1,000 milliliters by 8 hours. Now, let's go through the step-by-step process for calculating this flow rate using dimensional analysis. The scenario: you need to administer 1,000 milliliters of IV fluid over 8 hours. The goal is to determine the flow rate in milliliters per hour. Step 1, identify the goal. We want to calculate how many milliliters or ml will be administered each hour. So the final unit we need is ml per hour. Step 2, identify the information given. We know the volume to infuse is 1,000 milliliters and the time for infusion is 8 hours. Step 3, set up the dimensional analysis formula. This is where we arrange the given information to cancel out unwanted units, leaving us with the desired unit, which is ml per hour. Start by placing the volume to infuse, 1,000 milliliters, over the time for infusion, which is 8 hours. So the formula looks like this: 1,000 milliliters divided by 8 hours. Step 4, perform the calculation. Now, divide the 1,000 milliliters by 8 hours, which gives us 125 milliliters per hour. Step 5, final answer. The IV flow rate is 125 milliliters per hour. Using this approach, we were able to determine the correct flow rate to safely administer the IV fluids.